APOORVA will now speak on learning the nuances of the operating microscope. We will keep the questions at the end in case we have time. I request Dr. Kumar, who is actually the chief instructor, actually, but I'm just the virtual one. And Dr. Hemant Murthy also to please come over to the dais, please. Yes, Doctor.
Thank you very much, Gurprasad sir, for including me in this IC of flattening the steep learning curve. My topic is about befriending the operating microscope. So most of this training is by Guruprasad sir, so his name is also on the first slide. Operating microscope can be very intimidating to most of us who've spent hardly 15 days of our MBBS days in an ophthalmology posting. So finally meeting a gigantic operating microscope in most part of the week can be quite intimidating and sometimes frustrating as well. So I hope to make it a little simple. So it's all about knowing the components, the special features and the controls. It's much like how we eventually learn to play a video game very effectively. We learn about hand-eye coordination and we incorporate our gross and fine movements in the hand-eye coordination game. We learn about illumination and magnification. So let's look at the operating microscope. So what we see here is the optical system, and this is the suspension arm. This is the lever for adjusting the optical system to our convenience, and it can house the optical system and move it by literally removing the weight and making it effectively weightless by adjusting the knobs, and that can help even in very extreme surgical conditions. So this is the lamp housing. I think somebody is operating the mouse. Yeah, please leave it alone. So this is the lamp housing which can house two lamps. This is the floor stand, and this is the wheels to maneuver the microscope across operation theaters or rooms when necessary, and this is the foot pedal. So these are some of the additions and subtractions to the operating microscope. Of course, you can add a video recording system. You can also add a side scope for the observer or the assistant to observe the surgeries. So like I said before, this is the balancing knob for addition or subtraction of the weight of the microscope head. So unless this knob is turned usually by the floor nurse, we cannot move the microscope head, and this is very important in microscopic surgery because we don't want even a millimeter difference in our field, which will actually translate to large movements in our field of vision. So these are some of the manual controls. These are the the illumination of the lamps, which can be programmable. So this, like I was saying, is the illumination lamp housing. So this can house two lamps. Video, it was playing in the preview room. So basically, when it has the the other lamp, once one of the lamp fuses, the other lamp can
the AV people help with the videos?
So when one lamp fuses, the other lamp automatically swings into action, and it is helpful to write the date on which the new lamp was put, so that we know that a new one has been placed, and we are not confused about which is the new one and the old one. So let's look at the foot pedal now. Foot pedal is also very intimidating for a novice surgeon. Here we have 4 places where we use the pitch feature, where this can be programmed to have to control the gross focus, and this one can be the fine focus. Also, this is the joystick that we use to go in the XY axis. This is for switching off the illumination, and this is for switching on. This is to increase the illumination, and this is to decrease the illumination. This can be programmed to start the video recording, and this can be programmed to reinvert the image as and when applicable, as in VR surgeries. So these are some of the illumination types. It was playing, I checked many times. Can I come? Okay. So right, thank you. So this is these are the types of illumination. Now we can see that this is the diffuse illumination with the surroundings illumination. This is the macula protector that's going to come in. This is helpful in protecting the macula from photo damage, or you call photic retinopathy. This is the slit illumination. This is a broader slit and a vertical slit. And there is something called the coaxial illumination, which has 3 modes again. The coaxial illumination can be exclusive only coaxial, wherein only the retro illumination is on, or it can be coaxial illumination with the surrounding light, or it can be the just the surrounding light on. So those are the modes of different degrees of coaxiality that we can use depending on our need. So this is the surgeon chair. These are also customizable to our convenience. We can get order for convenient lumbar support, or even wrist support and elbow support. The distance from the seat to the foot pedal is imperative because that ultimately makes the angle of the hip and the knee and the ankle at an ergonomic in a completely ergonomic way, so that there is minimal stress on our joints. And there is a neck and back friendly feature of the microscope also. This is tiltable from like almost 180-degree tiltable, and this also helps in extreme conditions, surgical conditions, like when you're operating on a kyphoscoliotic patient where you have to stand and operate, or any condition where the patient has to be sitting up rather than lying down because of their inabilities. So like I said before, this is the coaxial illumination. Here you can see that the surrounding light is on, so there is no coaxiality. This is coaxiality with the surrounding light. And this is, like I said, this is the coaxial with the surrounding light. There is one more feature where it is exclusively retro. And this is the aperture, which is adjustable from +2 to -2 degrees. Now let's look at the interpupillary distance. So this interpupillary distance is mainly when the two images of the eyepieces are finally merged into one. This can take many months and years also sometimes to realize what our IPD is. This is the diopter ring where the dioptric lenses are housed. This can go up to +5 and -8. So people with refractive error wearing their prescription glasses have to keep this at 0. This mark on the eyepiece has to be set to 0. People who do not want to wear their prescription glass with exclusive spherical error can use it from -8 to +5. And when we have the fusion of the two images from our eyepieces, which fuses into one, that's when we measure our IPD on the measurement ring. And like I said, this can be little variable in the beginning of our career. Sometimes when some surgeons have intermittent divergent squint, they can notice that over a long day of surgery, in the morning their IPD is say 64, and as the hours of surgery progress, it can go up to 65 because of fatigue. So those are some things that you have to keep in mind. So when we start using the microscope, it is important to get used to the magnification and, like I said, learn about hand-eye coordination. This is best learnt if we use low magnification to begin with. And also, to get acquainted to the final beast of a microscope, it may be helpful to use a slit lamp for even the small things that we do, like maybe a foreign body removal. Don't do it without the help of a slit lamp. Suture removal, decompression of the anterior chamber, we can start doing these things on a slit lamp to get used to the microscopic or a biomicroscopic system. We can also start using magnification in a smaller scale, like using spectacles or telescopic spectacles, or even the magnification loops for OPD procedures, like I said, and also for intravitreal injections. So when we don't know where our hands are when we are operating, and we see the eye and only the eye and not the entire instrument, we know that we have to start doing things on lower magnification. So we can start with extraocular surgeries like opening and closing conjunctiva, doing helping some steps in a surgery like trabeculectomy, or opening the conjunctiva for squint surgery or a scleral buckle, doing peritomies. These can be the initial steps where these steps can be done with less magnification. And always keep it centered, because when we don't center it and we use very high magnification, when we are doing the actual step, the crucial moment in which we actually need the microscope, that purpose is defeated. Like you can see, this surgeon is trying to make a side port, and because of the non-centeredness and the high magnification, when the actual entry is happening, the eye has rolled away from the field of view. And we have to be very familiar with the XY feature, and we have to know how to use the joystick, because more often than not we use our left foot, which we are probably not trained to use much. So the left foot has to be trained to use the XY feature of the on the joystick of the microscope. So this is called a XY axis decoupling button. This is something that we need to know. This is the centration, which if the black dot is at the center, then it is centered, and this can go up to 40 by 40 mm of movement. So this is how it moves. I hope you can see. One second. So this is how a reset of the XY axis happens. You can see the black dot is moving to the center of this here. This is the resetting of the X, Y and Z axis. So this has a movement range of about 40 by 40 mm. This is the reset button. You can see how it is moving. So, like I said before, when we start operating, we see only the eye, and we forget that the eye belongs to a head, and that head can move. And you have to bring your instruments to the center of the field and into the eye finally. So it's much like using these keyboard guards. If you've noticed, these F and J keys have this kind of referral points or landmarks, which help us in identifying where we are on the keyboard. So this is a re-inverting knob. This is especially useful in VR surgery, where you use an inverter to do retina surgeries. So this is usually what an assistant does for a VR surgeon. So basically, knowing your microscope and befriending it is about knowing the optical system, the foot pedal, and knowing about the optics of it, know the magnification features, the illumination intensities and the types, like I showed, the oblique, coaxial, plus minus 2 degrees aperture, the making of a slit, use of a macula protector, use of fine focus and depth of focus and zoom, and this XY movement and the range of movement, knowing the reset button, and knowing that the foot pedal has programmable features. I showed you that the center, left and right work can be programmed to use the reinversion of the view. So that's my presentation.